Well, hey guys, in today's video, I want to talk about the benefits of garlic for your skin. Now, there's a good chance you have come across a sensationalized internet post with regards to using garlic in very unconventional ways, whether it be taping it to your skin or making a paste out of garlic peels and putting it on your face, or tying it to your feet, sleeping in a bed of garlic, swallowing whole garlic cloves. People claim it clears their skin. I mean, I have seen it all, I feel at this point, but I hesitate to say that because the internet knows no limits. But truthfully, garlic is what one might label as a functional spice, meaning it has a wide array of biochemical compounds in it that have true health benefits, not just from a nutritional standpoint, but perhaps in helping with certain illnesses. Now, garlic actually has been utilized in traditional medicine for many years all over the world, and in fact, before the advent of modern medicine, antibiotics, garlic was a go-to to treat a wide variety of illnesses, including various epidemics like cholera, typhus, influenza, dysentery. It's true, it does have healing properties. Why? Well, it has a variety of phytochemicals, sulfur compounds, it has antimicrobial properties. It can help with bacterial infections, viral infections, fungal infections, parasitic infections. It also has a wide variety of antioxidants that can help offset oxidative stress and damage to lipid membranes throughout your body, including your skin. And we all know that our skin, being the largest organ and our first line defense, is exposed to a wide array of environmental aggressors that cause a lot of reactive oxygen species, free radicals. And we know that eating a diet rich in anti-inflammatory foods can help your body overall, including your skin, in handling a lot of these day-to-day aggressors. And garlic is no exception. Garlic has potassium, it has magnesium, manganese, selenium, zinc, iron. Now, it is by no means a cure for any particular illness, and it is not a replacement for established treatments. But if you like garlic and you're incorporating it into your diet, importantly, you're not allergic or intolerant to it, congratulations. You are incorporating a food that is probably having a lot of benefits. If you can't tolerate garlic in your diet, don't worry. These compounds and beneficial ingredients can also be derived from a wide array of other foods. There are several dermatologic conditions for which garlic is of interest. Number one has to do with the healing of ulcers on the lower legs. This can be especially an issue for people who have arterial sclerosis. This is a common health problem that is basically damage to the little tiny blood vessels, and it leads to overall poor circulation. When you have poor circulation, your skin cannot heal from injury, you cannot properly heal wounds, and you may be at risk for chronic ulcers, which are a huge health risk. Any type of chronically open wound is just a bed, quite literally, for different microbes to get in and can potentially get into the body and cause a really serious systemic effect. There's actually a research paper showing that in a randomized control trial, patients who were at high risk, they had them consume an aged garlic extract for 12 months, and in comparison to placebo, they had significantly better overall microcirculation. Now, obviously, this study is one where they are interested in people who develop lower leg wounds, ulcers, etc. However, one might extrapolate that to suggest, well, perhaps including garlic in your diet could potentially also improve circulation to, like, your scalp, for example, and may in theory help long-term with people who struggle with poor scalp health and or who struggle with something called androgenetic alopecia or pattern hair loss, where the hair follicles, they miniaturize, so you get a little baby vellus hair instead of a terminal hair, and that manifests with widening of the central part in women and a receding hairline in men. And measures that improve circulation to the scalp can improve that condition. But we don't have any studies looking at garlic for androgenetic alopecia per se. So to what extent this is going to be as generalizable to a wide audience, and to just say, oh, it's going to improve your circulation, more research is needed. The other skin issue for which garlic may be helpful is in really stubborn warts. Now, warts are caused by a virus. Warts are very common. There are genital warts, and then there are warts that pop up on non-genital skin, like your feet, your hands, your face. And I have videos, as a side note, on how to get rid of a wart. I give a lot of practical skincare advice for dealing with warts. So you definitely want to check that video out if you are someone dealing with warts. But there is a study out there that took a group of people who were dealing with really stubborn warts, had really problematic warts that were challenging to get rid of. And in the study, it was placebo controlled. So they took some of the patients and they applied garlic extract to the wart, and the other group of people who were the placebo control, they got just plain saline. And interestingly enough, the people getting the garlic extract showed a better clearance of their warts, and importantly, the warts did not come back in comparison to the placebo group, suggesting that garlic extract on a wart might actually help it go away. And I'm pointing this out because oftentimes if you go on the internet seeking out natural remedies for warts, you're going to come across somebody telling you to put garlic on a wart. Now, you might want to be careful for reasons I'll explain later with regards to just putting garlic on your skin, but it does show promise, meaning more research is needed. It shows promise, but again, this study was looking at a garlic extract, not the whole garlic, which is important. Number 3 potential beneficial outcome with regards to dermatology is in the treatment of denture stomatitis. Stomatitis is basically inflammation, in this case in the mouth, from dentures. It's something that a lot of patients who wear dentures deal with. It can be very painful, and it can limit an individual's ability to eat, and that ultimately can lead to unintentional weight loss and overall poor health. So it can really be an issue. It has a lot to do with friction from the dentures, trapping of moisture, saliva, and of course, Candida yeast. Candida yeast naturally lives in our mouth, but with someone wearing dentures, it can become too comfortable, and they develop these red patches in the mouth that are very sore and uncomfortable, especially where the denture hits the insides of the mouth. Now, the treatment for this, as I point out in some of my videos with regards to yeast infections, is a topical antifungal, and in this case, it's called nystatin. But if you've ever had to put nystatin in your mouth for this or other related conditions, you know it has a bitter taste. It's not the most desirable thing to use. It works, but a lot of people are just like, So there is a small study out there where patients consumed 40 milligrams per milliliter, so a solution of garlic extract, 3 times a day. They switched it around in their mouth versus nystatin, the standard treatment. Both groups showed good improvement in terms of a reduction of the redness inside of their mouth. However, people liked the garlic better. It was not bitter like the nystatin. It was preferable. So it suggests a potentially effective therapeutic there. And it makes sense, garlic has antifungal properties to it. It has anti-inflammatory properties as well. So it may help in that regard. Now, before you go sucking on raw garlic, keep in mind this was a solution of garlic extract, and to what extent you're going to see the same result trying to intervene in any other way while also not causing adverse effects, which I'll get into in a moment, be careful. All right, now the next group of people that might benefit, we already talked about circulation, but some patients develop venous ulcers due to disease with the veins, poor circulation again. And so this is a study looking at applying an ointment with garlic extract in it to ulcers. This isn't the best study. It needs some help. It wasn't randomized. It wasn't placebo controlled. But basically they put in ointment with garlic extract, and suggested that the patients in the study had better closure of their ulcers. Now, the ointment had some other things in it, so it's really hard to say to what extent it was just the garlic. It had calendula, which we know as anti-inflammatory, and it had St. John's wort. Is there any evidence for using garlic for hair growth? Yes. So remember, whenever we're talking about hair loss and hair growth, not all hair loss is the same. People online tend to lump hair loss into just one big lump, but there are so many different types of hair loss. So one type of hair loss is called alopecia areata. I have a whole video on this, so if it's something that you struggle with, you need to watch the video because I outline all the things you need to know about the course, the treatment options, and other associated health problems that can come along with alopecia areata. But if you'll remember back from that video, it is basically an autoimmune hair loss, meaning one day your immune system is like, hey, I don't have much else going on. Why don't we just, instead of defending against pathogens today, we attack the hair follicle. And that's exactly what happens. It decides it doesn't like something in the hair follicle for whatever reason, genetics, environmental exposures, who knows, and all of a sudden you get a bald patch. And it can be a bald patch, or it can involve hair all over your scalp, your eyebrows, body hair. Any body site can be affected by alopecia areata. A lot of patients, after several months, the hair will grow back. It is not a scarring form of hair loss, but it's super distressing to go through. And there are a variety of treatment options, again, which I cover in that video. But turns out garlic extract shows promise in that patients in a small study showed good results when garlic was utilized alongside an anti-inflammatory. Patients got better results compared to just the anti-inflammatory corticosteroid alone. Now again, it is not a cure for alopecia areata. It is not a slam dunk, use this and it'll go away, but it does provide compelling evidence to suggest that this might be something that could be helpful in the future for people dealing with alopecia areata. One thing I want to point out before we get into the risks around garlic DIYs for skincare and why you shouldn't just jump on a garlic bandwagon and start putting it all over the place, one of the reasons we have to think about as to why any of these studies where they're putting a garlic extract on the skin can elicit improvement in conditions is the fact that I talk a lot about how anything you put on the skin can potentially be irritating. Garlic is no exception. Garlic can be super, super, super irritating. But here's the thing. There are certain skin conditions, hair conditions, for which eliciting local irritation, inflammation, is a good thing. And some of the things we've talked about here are a case for eliciting local irritation. Warts, for example. If you ever go to a dermatologist for a wart treatment to try and get your warts to go away faster, the majority of what they are going to do is to try and rev up your immune system in the skin. Try and trigger some kind of destruction locally to generate a lot of inflammation, because the cascade of events that occurs is it stimulates the immune system to come in and clear out the wart-causing virus. Whether that be spraying liquid nitrogen on and freeze-thaw cycles to destroy cells and elicit an inflammatory reaction, or whether it be injecting things into the wart that your body is like, whoa, what the heck is this? Let's come in and try and clear this up and heal things, and the wart virus gets taken out. So it makes some sense, and you have to think about, yes, garlic is packed with all of these wonderful compounds, but at the end of the day, we know it's super irritating to just put garlic on the skin. So is the improvement in wart clearance and reduced recurrence risk with that one small study, is that all related to the fact that garlic is just a good skin irritant? And that's what explains it. Likewise, alopecia areata. A lot of the treatments that we do actually cause an irritant contact dermatitis. In fact, there is a type of treatment for alopecia areata called contact sensitization, where we put something on the skin, on the scalp, in an effort to elicit a contact dermatitis, to get the immune system to kind of switch gears, so to speak, stop attacking your hair follicle. And it really can be quite helpful. So is garlic in this study really just a a type of contact sensitization therapy. Normally we use something like squaric acid to do this, but could garlic do the same thing? Probably, but more research is needed. How bad of an irritant contact dermatitis can garlic cause to the skin? It can cause a pretty bad one. Not only can it be super irritating, but you also can develop an allergy to it. People who handle garlic a lot as part of their occupation, they frequently can develop a contact dermatitis on their hands that actually can get mistaken, misdiagnosed as other hand rashes, such as nail fungus or psoriasis, but really it is an allergy to the garlic. And when they stop coming in contact with garlic, when they start protecting their skin from the garlic anytime they have to handle it, they can get improvement in this hand rash problem because it's not these other rashes, but rather it's an allergy to garlic. For example, a lot of chefs, food handlers will develop a dermatitis on the fingertips with cracking, painful fissures on the fingers. They might get misdiagnosed as having dyshydrotic hand eczema, or misdiagnosed as having psoriasis, or because it can then involve the nail folds and lead to inflammation around the nail that impacts nail growth. They get ridging, they get breakage of the nails, and it starts to look like, well, a nail fungus infection. As a side note, fingernail fungus is very uncommon. Toenail fungus, common. Fingernail fungus, uncommon. So if you have a problem with your fingernails and someone, a healthcare provider, tells you point blank, just taking a look at your nails, oh, this is fingernail fungus, seek another opinion or push back on that, because it's not that common to have fingernail fungus. It's a lot more common to have other nail problems in the fingernails that look like nail fungus. And if you're someone who handles garlic as part of your occupation, well, this could be you. But it goes above and beyond just an allergic contact dermatitis of the fingers. There are a lot of cases in the medical literature, and I have seen firsthand patients who have developed pretty serious skin rashes from trying to put garlic on their skin. Garlic paste that they make at home, garlic that they put directly on the skin, all the way from just basic irritation, itching, oozy rash to really significant, large, extensive blisters, deep wounds, and skin injury, a type of basic burn. I could show you some pictures here, but they would be very graphic. YouTube would censor that. They don't like those types of graphic images, and a lot of you guys don't either. So I will put a link to some case reports in the description box that are open access if you want to see these yourself for educational purposes. They are available publicly. What about garlic dietary supplements? Taking in a lot of garlic. You know, just because it's got all of these beneficial compounds, you certainly can overdo it. And supplements are a territory in general where you start to get to a point where you likely can easily overdo it. And garlic supplementation is no exception, especially in the realm of bleeding. And taking garlic supplements can increase your bleeding, make you at greater risk for bleeding. This is particularly important to note if you plan to have any type of surgery, because it can make you more prone to bleeding, and that can complicate the surgery, whether it be a surgery to remove a skin cancer, whether it be a surgery to cut out a cyst, a surgery to remove an organ, anything. You definitely want to be careful with garlic supplements because they can increase the bleeding time, and that can lead to serious complications. So what do I recommend? I recommend enjoying garlic in your diet, provided you tolerate it and you're not allergic to it. Because it's a food that, in my opinion, makes things taste delicious and comes with a lot of potential health benefits. Stuff that our body needs, you can get from garlic, so use it in complement with a balanced diet, provided you tolerate it and you're not allergic to it. If you hate garlic, do not force yourself to eat garlic. Okay? Don't force yourself to eat things that you don't like just because they are good for you. There are a lot of things that are good for you that you could eat instead. But one thing I want to bring your attention to is, have you ever tried black garlic? So black garlic is a little bit different. it is aged and it turns black. White garlic turns black. And you might think, oh, is that weird? Does that become funky? Does it smell bizarre? Garlic, I can't imagine aged garlic, but it's not. It is actually a lot more, in my opinion, palatable than just straight up garlic. It's soft, it's chewy, and it's sweet. It does not have that strong garlic smell either. It is sweet. It is almost like you are biting into some kind of candy. It's sweet, it's not as savory. A lot of cuisines utilize black garlic, and it does not give you garlic breath. It does not come out through your sweat, make you smell like garlic. Highly recommend. I mean, it really just imparts such a nice flavor to food. So I wanted to mention black garlic because I know a lot of people don't like to eat a lot of garlic. They don't like the garlic breath thing. But have you tried black garlic? That's all I'll say. Have you tried black garlic? Anyways, guys, that's what I wanted to chat about in today's video with regards to the benefits of garlic for your health, for your skin. It is by no means a cure for any particular condition, but it definitely packs a punch in terms of nutrition and health benefits. So consider incorporating it into your diet if you like it and you're not allergic to it. All right, guys, if you enjoyed this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.